The trigeminal nerve is one of the cranial nerves, of which there are 12. The trigeminal is the fifth, and therefore it is the fifth closest to the front, fifth closest to the most anterior aspect of the skull. It arises from the pons and has the largest diameter of any of the cranial nerves. This is, of course, before the trigeminal ganglion. Now, we're just going to provide a quick overview. So I'm just going to provide an orientation. So, looking at the human skeleton, we have the anterior aspect, or the front, the posterior aspect, or the back, and then looking at it from a sort of a top-down view, we have our left side and our right side, and then in relation, obviously, to the spine, we have medial being closest and lateral being furthest away from. We're going to remove a lot of the bony anatomy. So here we have just the bony anatomy of the skull. So now what I'm going to do is I'm also going to overlay it with the craniofacial nerves. So as you can see here, the craniofacial nerves are shown in yellow. Now I'm going to go from our top-down view. Just going to spin the skull round so that we are looking at it from a top-down facing forwards. Now I'm going to begin by removing the top of the skull, and I'm going to zoom in. So here we have the clivus, and here is the foramen magnum. Now I'm just going to rotate. So here we have the occipital bone. So there are four parts. We have the squamous part, which is here at the back, and the basilar part that's there at the front, and then these two condylar regions here, which form the lateral aspects of the foramen magnum. Now I'm just going to remove that there and scooch forwards just a little bit. Okay, so here we have the other cranial nerves, just for orientation. So here is the trigeminal ganglion. Here is the optic nerve at the desiccation. So this is the optic chiasm at the point at which it crosses over. Immediately beneath that, we have this bony feature, which is part of the sphenoid bone called the sella turcica, which houses the pituitary gland. See, above that we have the olfactory tract, which is the olfactory nerve. Here is the olfactory bulb, sat above the cribriform plate of the ethmoid bone, and sat in between that is the cristagalli, right there. Now, the thing that we're interested in here is the trigeminal ganglion and the trigeminal nerve. So I'm just going to remove these just for simplification, so that we know which one we are dealing with. Okay. Now the trigeminal nerve has three branches, as can clearly be seen here, coming off the trigeminal ganglion. We have the most superior branch, which is passing up through this opening here in the sphenoid, known as the superior orbital fissure. And this is the ophthalmic branch, right there, the right ophthalmic nerve. And this goes up adjacent to the eye and into the orbit. And then we have the two other divisions, one which passes through the foramen rotundum, and this is the maxillary nerve, and then below the foramen rotundum is the foramen ovale, the passageway for the mandibular branch of the trigeminal nerve to exit the skull. Okay, now we're just going to look at the mandibular branch of the trigeminal nerve in isolation. as you can see, we have these various different branches all labelled up. Here we have the trigeminal ganglion. Here we have one of the main branches, the mandibular branch, which carries on down to this point here. Here we have the first branch coming off it, which is the lingual nerve. Here we have the inferior alveolar nerve, and here we have the auriculotemporal nerve. Now, here is the auriculotemporal branch, which I'm going to highlight for you. Here is the inferior alveolar, and here is the lingual. And there is the main root, mandibular. Now if we just come out to the side, here we have the auriculotemporal branch. Just go. Now the trigeminal nerve has two functions. It has a sensory component and a motor component. The motor component is conveyed by the nerve that we were just looking at there, the mandibular nerve, which also has a sensory component as well. And the trigeminal ganglion is where the sensory components synapse, and the motor nerves actually pass underneath the ganglion and connect with their sensory nerve counterparts outside of the skull, so just after it's exited through the foramen ovale.